Anyway,
Hi, I'm Elizabeth Velasquez and I'm a student nurse practitioner.
hi, my name is Anne Johnson.
And can I get your birth date?
It's August 1st, 1996.
And do you prefer to be called Anne or Miss Johnson or something else?
Anne is fine.
And I'm going to ask you some things about your general history, but I just want to know what brings you here today.
Well, nurse practitioner student. I wasn't feeling very well lately. I have just I have a little bit of a tightness or pain on the side, and then just difficulty going upstairs and just not feeling good at my voice. I lost my voice, so I don't know what's going on.
Oh, okay. So I'm going to get back to those symptoms. When did those symptoms start, by the way?
I don't know, maybe 4 days ago, 5 days, something
Five
like that.
days ago? Okay. Before I ask you further about that, I just want to, because it's my first time meeting you, I just want to get to know you better.
Sure.
So, can you tell me, are you married?
Yes, I was recently married, just last year.
And do you have any kids?
No, no, I don't.
Any pets?
No.
And where do you work, or what's your job?
I'm office assistant.
Office assistant, okay. And do you enjoy your job?
Yeah, it's alright. Yeah.
And I'm just going to ask you in general your medical history. Do you have any medical issues like diabetes or high blood pressure or things like that?
No, no, not that I know.
And anything related with your lungs like asthma or anything like that?
Mm, no, not that I know. No.
No? And do you have any surgical history, any past surgeries?
Um, no.
And family history, anybody in your family have chronic diseases like diabetes or high blood pressure or cancer?
Um, my mom has high blood pressure. Um,
Okay.
no cancer. God forbid.
Yeah. And so you said that is this happened about 4 or 5 days ago that your lungs started hurting and that you're having some shortness of breath. So how would you um, like how would you rate the pain from 0 to 10 when you do have pain there?
I would say maybe 4 or 5.
And is there anything that relieves the pain? Like,
I just need to kind of sit down, breathe in, and it's usually goes away.
and is there anything that makes the pain worse?
Oh, when I go up the stairs, to my apartment on the third floor, I have difficulty catching my breath then, and if I have groceries, that's even worse. So I take an elevator when it's working.
Oh, okay. And do you have any allergies?
Mm, strawberries.
You're allergic to strawberries?
Mm-hmm.
And do you smoke?
Well, from time to time, not very often.
Like how many packs per week or per day? Well, per
Maybe
week.
back a week.
A pack a week, okay. And do you drink?
Occasionally.
How many drinks per week would you say?
Maybe 1 or 2.
Okay, and let's see. And now I'm just going to do a physical assessment on you, if that's okay.
Yeah.
So I'm gonna go wash my hands, and then I'm gonna get you to change into a gown. And then I come back. My hands are washed. Okay, that's a nice color of gown. And now I'm gonna just check your vital signs, okay? And I do see your blood pressure is a little bit elevated. Your heart rate's elevated too. and your temperature is elevated as well, and your breathing also. Yeah, I'm seeing some elevation. I'm just gonna check. First, I'm gonna just check your head, and I see that everything is intact. Everything is um, normal cephalic, and distribution of hair is normal, and no bumps or anything like that. I'm gonna just check your eyes, okay? And your pupils are round, reactive to light and accommodation. Okay, I'm just gonna look in your nose too, and I do see some discharge. I forgot to ask you, were you having some discharge, or were you spitting up anything when you?
Yeah, that's you. Thanks for asking. I was when I cough, I have this green sputum comes out, really gross.
Oh, okay. And now I'm just gonna look in your mouth. So just say, yeah, I do see your tonsils are a bit swollen to maybe +2. I'm gonna just check your ears now with my ophthalmoscope here. And I can see your your eardrum. It's pearly gray, and the cone of light for your left ear is at 7, and cone of light for your right ear is at 4. I'm just gonna check your lymph nodes, okay? Precordial, pre-occipital, post-occipital, submandibular, submental, superficial cervical chain, deep cervical chain, submandibular or subclavicular. You know, there is some swelling here like that could be indicative of an infection. I do see that. So I'm just going to listen to your lungs now. Okay. So when you feel the stethoscope, I want to do all lobes from right to left. So take a breath when you feel my stethoscope. I'm just going to do the back now. So when you feel my stethoscope, take a breath, okay? Okay, and I'm just going to do something else. When we want to check if there's some consolidation, meaning there's something in your lungs, like an infection, we go 99, okay? So I'm gonna, when you feel my hands on you, just go 99.
99, 99, 99, 99, 99, 99.
Okay. And on this side.
99, 99, 99, 99, 99, 99.
Okay, I do see some consolidation, or I feel something there. Just to confirm, I'm also going to do this other test where you say, when I put my stethoscope on you, just say E-E, okay?
E-E, 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 E-E,
and it's on the back.
E-E, 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 E-E.
And I'm just gonna do some percussion here. Okay, So I'm just gonna tap and I'm just gonna
Okay.
just gonna make sure I get all the lobes here on this side. And I'm gonna do the back as well. And let me know if you need a break, okay, or some water.
Okay. I'm okay. Thank you.
Okay. And now I'm just gonna listen to your heart. Okay. Sure. Because you were saying you're having some issues. So first I'm gonna start with the aortic pulse, which is second intercostal space, right sternal border. So second intercostal space. And we're just gonna listen to your heart. And then we're gonna listen to the pulmonic pulse, which is the second intercostal space, left sternal border. And then Erb's point, where the pulses are equal, which is the third intercostal space, right at the sternal border. And then the tricuspid pulse is the fourth intercostal space and left sternal border. And then the point of maximum pulse is the mitral, which is the fifth intercostal space. So mid-clavicular line. So it's right here. And I can hear your heart beating. So it's just, you know what, it's still like a normal pulse. I'm gonna say like 7 to 8 beats per minute. And I didn't hear any murmurs. I didn't hear any abnormal sounds. But I did hear some sounds, some concerning sounds, especially in your right lobe.
Oh.
But I heard it on both actually. So what I want you to do is I want you to go for a chest x-ray, and then we're going to get the results of that x-ray, and we're going to see you may need antibiotics, okay? So I want you to come here or give me a call in 2 weeks, or not 2 weeks, 2 days, 48 hours, and we're going to get you your antibiotics and just see how you're doing, okay? Because you seem to have had this for a little bit of time. Yeah, and you're not, just seeing, like your temperature is elevated, and you should have some comfort measures, maybe take some Tylenol. Take good care of yourself today, okay?
Thank you.
And just rest. If you have to, you may not be able to make it to work tomorrow, I'm not sure. Get your husband to do all the chores, and whatever you need to do, okay? You take care of yourself. So the x-ray is that way, and then I will get back to you, okay? It was so nice to meet you today.
Nice to meet you. Thank you very much.
Johnson or Anne. Okay, take care. I hope that